If you've ever asked members about how their appointments went, you've likely noticed the responses tend to vary. Some say everything was fine, some don't have much to say. Others may use it as a chance to vent about something unrelated. And from the outside, it's hard to know what really happened. Was the appointment productive? Did they get what they came in for? Or were they just going through the motions to check it off the list? What we've seen, and what you probably experienced too, is that the feedback doesn't always match the visit. A member might leave the office smiling, but a few months later, you'll see it in their behavior, or you'll feel it in your CAPS scores. And that's how we knew something had to change. Because once your member walks out of that office, that's when things get complicated. That's when they're left to figure it all out on their own. What to schedule, who to call, how to follow through. And all of that happens behind the scenes without anyone realizing just how lost they really are. That's the gap, and it's happening quietly every day across every network. That disconnect, the space between what patients say and what they're actually dealing with, isn't just a communication problem. It's a navigation problem, and it's affecting everything downstream. When patients don't understand what to do, they don't follow through. Appointments get missed, referrals fall through, diagnoses are delayed. They don't build trust, they don't ask questions, and they don't form a working relationship with their care team. From the system's perspective, it looks like non-compliance. But in reality, no one ever showed them how to navigate any of it. Because when your beneficiaries aren't prepared, it shows up everywhere. Not just in CAPS, it shows up in HEDIS measures, in your follow-up care data, your medication adherence scores, your preventive screening rates. And improving those measures doesn't start with another reminder system or another report. It starts with the patient actually understanding how to move through their care in the first place. CAPS and HEDIS are powerful measurement tools, and CMS has made it clear that patient experience, access, and engagement are central to how we define quality. These programs are built to track how well people are following through, how well systems are responding, and where improvements are needed. So maybe the question isn't just what happened, but what happened before that. Before the missed screening, before the follow-up was dropped, before the gaps showed up in your data, because right now we measure everything that comes after. But if we want different results, we need an intervention that comes before, one that lays the groundwork, one that gives people the skills to navigate, to communicate, to carry their plan forward with confidence. That moment, the one before everything else begins, is what we've been missing. And it's the one that changes everything that comes next. We've come a long way in healthcare. EHRs are fully implemented. Telemedicine is here to stay. Patients can check in from their phones, pull up labs at home, schedule a follow-up without ever picking up the phone. And after the pandemic, we've seen just how fast the system can adapt when it needs to. Technology accelerated, communication channels expanded. We made healthcare more accessible in a lot of ways. But even with all that progress, something still isn't clicking. Because systems don't run on access alone, they run on understanding. And right now, that's the piece we keep skipping. Most patients are overwhelmed, not by a lack of tools, but by too many. Portals, messages, instructions, options, all coming at them without a foundation to stand on. They're expected to make choices, follow plans, track appointments, coordinate records, and advocate for themselves without anyone ever teaching them how. They need more than a checklist, they need a framework. Something that helps them understand their role, how the system works, and how to move through it with confidence. Because when patients are prepared, really prepared, the tools we've already invested in can finally do what they're meant to do. And we need to do that without adding more to the provider's plate. We don't need another thing that asks more of professional care teams. We need something that lifts the system without weighing anyone down. That's why we built Patient Better. It's not another platform for providers to log into. It's not more training. And it doesn't require a single change to your workflows. The truth is, healthcare has leaned for too long on the same overextended resources, the same go-to people, the same pressured teams, especially physicians. Everyone's pulling from the same well. But there's another resource in the system that's still largely untapped, the patient. Their knowledge, their understanding, their ability to participate in their own care. We tap into the one resource that doesn't add to the bloat. Because when patients are prepared, the entire system runs lighter, faster, and smarter. That's what Patient Better activates. Patient Better is a self-guided tool built for non-medical people that gives patients a foundation in how the system works and how to move through it. It's designed to fit right at the beginning of the care experience before the first steps are measured. So by the time the system starts asking patients to act, they already know how. It runs quietly in the background, helping people understand how to use their benefits, how to coordinate care, how to move forward with confidence. And when that happens, everything else you've built, from your workflows to your metrics, works better. This isn't about changing the system. It's about unlocking its potential by finally preparing the one group of people at the center of it all, your members. Once your organization is ready to roll out Patient Better, implementation happens almost instantly. You place your order, and within minutes, you'll receive a secure email containing your deployment materials. Inside that email is a pre-written outreach template, customizable but ready to use as is. All you have to do is send that message to your members. That's it. That single email is what activates the program. From there, the system takes over. Patient Better is delivered digitally to your members and begins guiding them through the process. You'll start seeing responses almost immediately, and those responses fall into 4 clear categories. Some members won't open the email. Some will start the program and complete the Healthcare Proficiency Challenge. Some will opt out using the empowerment form, and some will qualify for and enroll in the full Patient Better program. From there, Patient Better tracks their journey through completion, certification, and beyond. No portals, no workflow changes, just real-time visibility into member readiness and meaningful engagement right from the start. Patient Better was built in response to where healthcare is today, not where it was 10 years ago. And we know that for many Medicare Advantage plans, the pressure is real. Whether you're at risk of losing stars, looking to rebuild after a tough performance year, or simply trying to protect what you've worked hard to earn, the stakes couldn't be higher. This program is designed for plans that are serious about turning the member experience into a measurable strength, not a liability. We're here to support plans that want to close their gaps, improve their outcomes, and create a stronger foundation for long-term star ratings performance. Our mission has always been about helping people better understand and navigate their healthcare. But this is the kind of solution that lets everyone win. Your plan stays competitive, your members feel supported, and the system gets a little easier to move through for everyone.